Good day, everyone, and thank you for giving us the opportunity to present our research. Today, we will discuss our study entitled Effectiveness of Progressive Barefoot Training on Ankle Stability Among Recreational Runners in Iloilo City. Running is a popular and accessible form of physical activity in Iloilo City, offering significant health and fitness benefits. However, running related injuries, especially those involving the ankle and foot, are common among recreational runners, often limiting participation and performance. While footwear technology has advanced, recent evidence emphasizes the importance of strengthening the intrinsic foot ankle complex to improve stability and efficiency. Barefoot training has emerged as a promising, low cost intervention shown to enhance intrinsic foot muscle strength, proprioception, and running biomechanics when introduced progressively and safely. Despite its potential, most research on barefoot training has focused on Western populations, with limited local evidence in Southeast Asia. Additionally, current studies present mixed results and lack standardized protocols, highlighting the need for stronger community based research. So moving on to the statement of the problem. So the main problem of this study is what is the effectiveness of progressive barefoot training on ankle stability among recreational runners in Iloilo City? Specifically, it also seeks to answer the following questions. 1. What is the profile of respondents in terms of A. Sex and B. Age? Next, what are the pre-test and post-test ankle stability scores of participants in both the experimental and control groups? Third, what are the post-test ankle stability scores of participants in the experimental and in control groups? Fourth, is there a significant difference between the pre-test and post-test scores of experimental scores and control groups? So from this research problem, we developed objectives that directly address it, and from these objectives, we formulated hypotheses that predict the expected effects of progressive barefoot training based on the studies we reviewed. So moving on to the significance of the study, this research is significant for multiple stakeholders. For recreational runners, it highlights a practical method to improve ankle stability and reduce injuries. For physical therapists and sports coaches, it provides evidence supporting the use of barefoot training to enhance neuromuscular function and muscle coactivation, as shown by both De Villiers and Venter and Tam et al. These findings can inform training programs, rehabilitation strategies, and injury prevention initiatives, particularly in urban environments like Iloilo City, where runners often train on varied surfaces. So for the scope and limitations of our study, we limited participants to recreational runners aged 18 to 40 years old in Iloilo City, following a progressive 8-week barefoot program conducted on safe surfaces such as grass and outdoor courts. This mirrors the controlled approaches of De Villiers and Venter. Our study focuses on short-term neuromuscular and stability outcomes, consistent with the cited studies, and does not measure long-term injury incidence. This allows us to isolate and observe the specific effects of progressive barefoot training on ankle stability. So lastly, for the definition of terms, in this study, progressive barefoot training refers to an 8-week structured program where participants gradually transition from short barefoot drills to continuous barefoot running, enhancing foot strength, proprioception, and biomechanics. Next is shod running, which is the usual practice of running with shoes that provide cushioning and support. Next is recreational runners, which are adults aged 18 to 40 who run at least twice a week for leisure or fitness. And lastly, intrinsic foot muscles are small stabilizing muscles in the foot that support arches, balance, and ankle stability, which are expected to strengthen through barefoot training.
Here are existing related literature for a study. According to Azevedo et al. 2016 observed that progressive barefoot running reduced impact forces and improved shock absorption, supporting the safety and mechanical efficiency of gradual barefoot exposure in the study. According to Latour Roman et al. 2016 found that barefoot training reduced inversion, eversion motion, and improved foot strike mechanics. And according to Allender et al. 2021 found that long-term barefoot running improves dynamic stability, highlighting that barefoot exposure leads to progressive neuromuscular adaptation. A study by Raurain et al. 2024 demonstrated that 12 weeks of barefoot exercise produced large improvements in SEBT scores among marathon runners. And a study by Wagemans et al. Demonstrates that barefoot athletes have superior ankle stability compared to shod athletes during dynamic activity. And Han et al. 2015 emphasizes that enhanced proprioceptive feedback from the ankle improves joint stability. According to Garcia Arabe 2024 showed that barefoot running increases foot muscle activation and ankle mobility, which are key factors for ankle stability. Another study by Sanjana 2021 reported that ankle and foot injuries are highly common among recreational runners. And according to Matjas et al. 2022, found that foot core training improves foot ankle control, which supports the strengthening expected from barefoot work. And finally, Zhang 2021 showed that transitioning to minimalist or barefoot conditions affect ankle loading and highlighting the importance of a gradual, progressive program such as our 8-week protocol. For intrinsic foot muscle strengthening, a supporting study by Curtis et al. 2021 observed that a 57 increase in intrinsic foot muscle strength in minimalist shoe users, showing that barefoot-like conditions enhance intrinsic foot muscle activation. And according to Wei et al. 2022, through a meta-analysis, confirmed that intrinsic foot muscle training improves both static and dynamic balance, validating the inclusion of foot core strengthening in our foot protocol. For our combined intervention, a study by Hossein Zadeh et al. 2024 demonstrated that balance and strength training improve joint position sense and dynamic balance. And El Goat-Arwart 2025 found that barefoot plyometric training enhanced proprioception and ankle stability and agility. And lastly, by Zhu et al. 2023 showed that proprioceptive training significantly improved balance and ankle stability in people with chronic ankle instability. For our assessment tools, according to Bowden et al. 2019, confirmed that the STAR excursion balance test is a highly reliable measure of dynamic balance and ankle stability. This supports our study because it validates SEBT as an appropriate and dependable tool for assessing changes in ankle stability. And lastly, according to Griebel et al. 2012, showed that the STAR excursion balance test effectively identifies postural control deficits and track improvements after lower limb interventions. Collectively, these studies justify the design of our 8-week progressive barefoot training protocol, validates the SEBT as an outcome measure, and support our hypothesis that, such as training enhances ankle stability, proprioception, and neuromuscular control among recreational runners. This study is supported by 3 key theories. First is the foot core system theory. Explains that strengthening the intrinsic foot muscles naturally activated during barefoot activity, thus improving arch support and ankle stability. Secondly, the theory of proprioception and sensory motor control shows that barefoot conditions enhance sensory feedback from the foot, thus improving balance and neuromuscular control. Lastly, the principle of progressive overload supports our 8-week gradual program, ensuring safety, adaptation, and maximizing stability gains. Together, these theories justify the use of progressive barefoot training to improve ankle stability in runners. Here's our conceptual framework. The independent variable will be progressive barefoot training, and dependent variable will be ankle stability.
Our research uses a quasi-experimental pre-test, post-test control group design. Participants are selected purposefully based on set criteria and are then assigned to either experimental group, which performs an 8-week progressive barefoot training program, or the control group, which continues their regular shod running routine. This design allows us to measure changes in ankle stability before and after the intervention. The study takes place at the Iloilo Sports Complex, which provides safe grassy fields and court surfaces suitable for barefoot training and standardized testing procedures. The participants are recreational runners aged 18 to 40 years old who run at least twice per week. Only individuals without recent lower limb injuries or medical restrictions are included. Recruitment is conducted through local running groups and online announcements. All eligible participants undergo screening and provide informed consent. Ankle stability is measured using the 8-direction STAR excursion balance test. In this test, participants stand on one leg and reach as far as possible in 8 directions: anterior, anterolateral, lateral, posterolateral, posterior, posteromedial, medial, and anteromedial. Each direction is performed 3 times. The reach distances are normalized to leg length, and a composite score is computed to represent overall dynamic balance. Data gathering occurs in 3 phases. During the pre-implementation phase, we will secure ethical approvals, screen participants, obtain consent, and administer the baseline of SEBT. In the implementation phase, participants begin their assigned programs. The experimental group completes the structured barefoot training program, while the control group continues regular shod running. All sessions are supervised and done on safe training surfaces. And this is our intervention protocol. In the post-implementation phase, the SEBT is administered again using the same procedure to ensure consistency, and participants provide feedback on their experiences. Ethical considerations guide the entire process. Participation remains voluntary, all information is kept confidential, and the safety of participants is prioritized. Sessions are supervised, and any discomfort or pain is addressed immediately. Minimal compensation such as refreshments or transportation assistance is provided. For data analysis, Means and standard deviations summarize SCBT scores. Paired t-tests determine changes within each group, while independent t-tests or ANCOVA compare post-test scores between groups, with ANCOVA controlling for pre-test differences.